Hello, this is Dr. Robert Bouvier with the Health Centers of Michigan, and I've been traveling around a little bit, as you know, speaking for your company, and I've come across a few things, and we're starting to talk more with the cardiologists and other specialists regarding the beta blocker that your company has put together and is a remarkable medication. And I put down a few notes here. I'd like to go over them with you. As you know, we must follow corporate and guidelines and pharma code guidelines very closely. There's no doubt we have to follow all that. We have to adhere to the slide deck. But within the slide deck, there is opportunity to expand on certain things. Let me give you one of those things would be cost. Let me give you an example of what you can come back when somebody talks about cost. Most every place I go, a major objection is cost. And the way I approach that is that, number one, 70% of my patients, cost is the absolute most important thing, but with 30% of my patients, longevity, wellness, and healthcare, that's healthcare, wellness, and longevity, are a greater importance, and a $25 copay per month is not going to stop them from purchasing something. So when a doctor asks you, and their offices could be quite similar to mine, I'm sure. When somebody asks you, when the doctor asks you that this cost question, this copay question, granted, doc, I'll agree with you 70% of the time, but that 30% of the patients where longevity, wellness, and healthcare is vitally important to them, that copay is really not a big deal to them. So you can challenge them on that. I think as a drug rep, you have to stop asking for a few sympathy scripts. I think what you need to do is say, you know what we have here is a drug with excellent science. We've got a drug here with excellent anecdotal information. The drug's been around for 15 years, okay, plus. So then the only thing that's lacking is for the physicians themselves to go get their own experience. And we're all scientists. We would not allow you as a rep to bring me a study of an N of 4 or 5. You can say the same thing back to the doctors and say, listen, I'd like to challenge you and try this with 100 patients. How do you know how this drug works in your office and works period without you giving it a try? It's got great science, it's got great anecdotal information, and now go get your own experience. If you believe those first two, then getting your third is the last component. Asking just to, give me the top 10% worst of your patients. And as a rep, quit asking for a little 2 or 3, 4 or 5 sympathy scripts. Ask for 100, 200. Cardiologists have 5,000 patients on beta blockers. There's no reason you can't ask for 10% of the worst. So another comeback to, why this drug over something else. And in the slide deck, there's a slide that talks about the long half-life, and I know that's within your rules of the road, in your sales pitch, to talk about that. The way I present that, which makes a lot of sense to me, is that long half-life means that this drug is a lifestyle drug. Let me explain what a lifestyle drug is. A lifestyle drug is one that fits people's lifestyle. In this case, when we're talking about compliance, you and I both know, and the doctors know well too, that people don't take their medications correctly. So a lifestyle drug is one that works even if they don't take it. So on the average, let's say somebody takes it 60% of the time. In fact, the people who are going after incentives in healthcare, when we can actually get up to 60% compliance, we're actually getting paid more as physicians from the various insurance companies, including Medicare. So let's say 60% is our goal. If you take a BID dosing drug, that's 2 times a day dosing drugs, that's 14 pills in a week, and you take away 40% of those pills, that means there's 2 or 3 days that disease state is not being covered. You take a once a day drug like Vistalic, you take away 40% of those pills, because of the long half-life, they're still being covered from day to day. That whole week's being covered. That's the idea of a lifestyle drug. That's why this drug works so well. And for those people who are looking for quality they're looking for longevity, they're looking for wellness, they're looking for health care and prevention. They want to be able to use lifestyle drugs, and they're willing to pay for that. So the last thing I want to talk to you about is there's a lot of talk in healthcare reform about kind of a defensive posture that many doctors take, and I propose that if you ever get a teachable moment, and it applies very well in your sales process, is having a offensive practice versus a defensive practice. A defensive practice is responding to a love letter from Medco or some other insurance company saying thou shalt you step at it and use generics. I say don't participate with that conversation. Once you get into that conversation as a physician in that insurance company, then the insurance company's got you captured and your license captured. If you don't acknowledge that conversation and you actually offensively send a letter out requesting a drug because of concomitant disease state management and compliance, that this patient needs it for those two reasons, then what happens when that letter gets to the right people at the insurance company is the first reviewer takes a look at that and says, I have no idea, I don't know how to respond to this. They kick it up to the next person, it's usually an RN, and the RN says, I'm not going to practice medicine, I don't know how to deal with this. So she sends it to the medical director. Medical director says, I don't know how to, I don't want to practice medicine without seeing the patient. We'll approve this medication. I've been doing this for a long time, and it actually works very well. I first heard about this process from a nurse practitioner up in Maine, and that's how she's been practicing this offensive practice versus a defensive practice, and it works very well. I'd like to challenge you as reps to quit asking for the 3 or 4 or 5 sympathy scripts. I think we're scientists. As doctors, we're scientists, and I think it's totally in your realm to be able to ask for 100 scripts from a primary care doctor and even 200 or 300 from a cardiologist. If this drug has excellent science, which it does, and there is good anecdotal information, meaning that this drug's been around and being used by millions of people, not just in the United States but in Europe, then the only thing lacking is for the doctor to go get their own experience. They can't scientifically, every which way, they cannot get good experience without trying it with a lot of patients. Like I said before, the doctor would not allow you to give them a study of an N of 4 or 5 in a study. For a doctor to go get good experience when they're find out how these drugs actually work, they need to put 100, 200 people in their practice on this medication. So I would strongly recommend that you start challenging your doctors, especially the cardiologists, on using this drug not just a few times but many times. This is Dr. Robert Bouvet with the Health Center of Michigan. Hope this helped you. Take care.